Thank you very much. Okay, so good afternoon, good evening, and good morning to you all. Thank you all for making time to participate in this maiden program. It is the Global Respiratory Care Month, and in Africa, I always say Africa is big enough to celebrate in a month. We can't celebrate Africa in a week. So, the Africa Respiratory Care Association is organizing this maiden global or um, bigger respiratory care month for respiratory therapists and respiratory care practitioners across the continent and beyond. And this webinar is brought to us by the Africa Respiratory Care Association. The Africa Respiratory Care Association's mission is to reduce the burden of respiratory diseases in Africa by strengthening respiratory care workforce and promoting innovative solutions to respiratory care. And the webinar is proudly brought to us by Zopec Medical. Zopec Medical is a medical company that produces or designs advanced hospital grade power solutions, that is uninterrupted power solutions that ensures seamless critical care transport, especially for neonatal, respiratory, or any other therapy that you want to give to your patients. So, for instance, you want to transfer your patients from one unit to another, maybe to the maybe to the ECG unit, or to do radiography, or to even walk the patient. You need uninterrupted power systems that will support your medical devices. And Zopec Medical has these devices to support you. My name is Dorothy Honey Bender, the founder and president of the Africa Respiratory Care Association. So today, our moderator, I'm just going to say something brief about her. You will get to know her very soon. She is a Nigerian of Igbo descent from the western part of Africa. She resides in the United States, working as a respiratory care practitioner in one of the capital's busiest hospital and a professor at the University of the District Columbia in Maryland, USA. Her passion for respiratory therapy profession and her commitment to saving lives locally and globally led her to earn master's degree in respiratory care leadership and a doctoral degree in health sciences with a concentration in global health. In addition, she is an asthma COPD educator and navigator, collaborating with pulmonary clinics to advocate for and empower patients with these conditions. She is also the founder and CEO of the Global Asthma COPD Outreach, also known as GACO, and the Director for Advocacy and Policy for the Africa Respiratory Care Association. Our moderator today is Dr. Ngozi Ibe. Dr. Ibe, our audience.
Thank you very much. Thank you, President Dorothy. And thank you, everybody. Welcome. Good morning, good afternoon, good evening, wherever you're calling from. I'm so excited to be here and to be moderating this session. And I want to say happy Respiratory Care Month from Accra. We're going big the whole month. So I'm excited. I hope you all are too. And so I will have with me today we are going to be talking or chatting with respiratory therapists in the 5 African countries that have established a respiratory therapy program so far. So we want to hear from them. We want to know, what motivated them to start the respiratory therapy program or profession, the challenges they're facing, and just a way forward. And maybe that will encourage other countries as well, or the leaders, or maybe policymakers that called in here today to initiate that profession, because it's a vital profession. So again, happy Respiratory Care Month to everybody. So this respiratory therapists, they are actually country directors for Africa Respiratory Care Association. And I will mention, I hope they are here. I believe so. We're calling it from different places. Internet can be an issue. So we have Maha from Chad, Haptamo, Ethiopia, Moaz of Egypt, and Mula, Ghana, Ebenezer, Liberia. And if they're here, I will want you all to, put on your video so we can see your faces. So these therapists are actually pioneers. I'll say they are pioneers in respiratory care in Africa, right? They are not only respiratory therapists, but they're also educators, they're advocates, and they are change makers as well. Change makers. We're all advocating for better lung health in Africa. So thank you all for being here and turning on your videos. I appreciate it. So I will start with an introduction, a brief introduction. I want them to introduce themselves briefly, tell us, their name, their profession, which we already know, and then the country where they are practicing or the country that they are representing today. So I will want to start with Maha. Maha, if you can unmute yourself and just introduce yourself briefly and tell us what country you're representing and your name. Thank you.
Thank you. Thank you, Dr. Nagoji. Hello, good evening, good afternoon, everyone. My name is Maha Hamad. I'm a country director of SAG, and I have a bachelor science in respiratory care, and I'm registered respiratory therapist, Saudi Respiratory Care Science. And now I'm a master student in respiratory care. I'm the founder of Respiratory Chad country, a respiratory care practitioner at Chad Ray Foundation Hospital.
Thank you very much. Thank you. And Haptamo, please. Thank you.
Okay, thank you. First, I want to thank you, African Respiratory Care, for organizing this important and inspiring event. My name is Haptam Zalalam. I'm deeply passionate about lung health. I'm from Ethiopia, currently serve as ARCA country director for Ethiopia. I have worked in healthcare about 13 years, starting as clinical nurse. Later, I became nurse anesthetist. And for the past 3 years, I have been working as a respiratory care practitioner at St. Paul Milne Medical College. Recently, I moved to Seychelles and working at Seychelles Hospital, but my focus is remaining the same, to delivering high quality of respiratory care and strengthen this profession wherever I go. Please give me a moment to acknowledge some important individuals and organizations to develop respiratory care in Ethiopia. First, my sincere appreciation goes to Mr. Haptamu Kali for his dedication and leadership from the very beginning. He played a key role in starting the first respiratory program at St. Paul Milne Medical College. Second, I want to thank St. Paul Milne Medical College for taking this responsibility and leading the way to establish the first RT program in Ethiopia. And finally, my heartfelt thanks for my fellow respiratory therapists. Your hard work, commitment, and passion for helping patients to have been central to strengthen and support Ethiopian respiratory care as a profession. So I'm very proud to be part of this team. Thank you, Dr. Ngozi.
Thank you very much, Mr. Haptamo. Thank you. I appreciate that. And do we have Mr. Beneza, please?
All right. Thank you. Thank you very much first to Aka. My name is Ebenezer Sufle. I'm from Liberia. I'm an RT, president for the Liberia Respiratory Care Association. And I also want to thank Dr. Davis, who is my mentor, who introduced me to ACA. So also not forgetting my hardworking team, the Liberia Respiratory Care Association. Thank you very much.
Thank you very much, Mr. Beneza.
Okay, I can stand in for Mula for Ghana.
Yes.
Okay, so
Thank
my
you.
name is, so in this capacity, I'm here as a part of the panel. So my name is Dorothy Honeybender, and I am the president for the Africa Respiratory Care Association. And I want to also use this great opportunity to thank the faculties and staff of the University of Ghana for training us to become respiratory therapists under the leadership of Dr. Esther Brobe. And I also want to recognize our governors at the time, Dr. Audrey Forson, Dr. Ofosu Apia. I want to use this great opportunity to thank um, Professor Ferdinand Ayukumi, who was the former provost at the time that helped to establish the program, and not forgetting the person of Mr. Kwame Ahelegbe and Dr. Lisa Trujillo and Dr. Karen Shell, as well as Kansas University Medical Center, USA. Thank you.
Thank you very much. Thank you all again for being here. And again, these pioneers of respiratory therapy in their countries are, they started the program, really the profession in their different countries. And I want to know actually how you got to hear about respiratory therapy. What made you join, or what made you become a respiratory therapist? I know my journey, but it's not about me today. It's about you all, and how to encourage others to actually move forward with the profession and help our people back home in African countries that are battling with respiratory diseases. So may I know really what motivated you to become a respiratory therapist? And anyone can go first. Actually, it doesn't really matter. What motivated you to be a respiratory therapist?
Okay, I'll go first.
Mm-hmm.
So it was this day, like 7 years ago. Um, I've always been passionate about the medical field. So I saw this notice, written notice, like announcement that are you passionate about medical field? Are you passionate that you want to save life? So, and this announcement drew my attention, and I wanted to know what respiratory therapy was rather. So I took their contact, and and I placed my call. After I placed my call, and you know, they give me description of the place, locations, and what have you. So I made my way there, and the person I saw, it was this the pioneer for respiratory therapy in Liberia. And his name was Mr. Mo, Joseph Mo. Mr. Mo, he was very, very passionate about respiratory science because he had studied in the state, and he was an RT in the state for more than 30 years. So, he had come back to Liberia, and he was ready, very uh, instrumental in teaching the young people, the young folks, and also introducing this new profession. So he introduced the profession to me, and then I wasn't still really inspired by it. So I just said, all right. So this day, because but then the school was attached to the hospital, because back then we had the hospital downstairs and the school was upstairs. So so
I'm sorry, before you continue, I will just have to put a little time so that we can get to every other question. Okay, so in a nutshell, go ahead.
so I went there, fast forward, and I saw him performing um, intubation, on this critical patient who on this patient who was not breathing and what have you. All of the other health practitioners, they all, they were just standing, in amaze. I was so amazed by how the late Mo resuscitated this patient, and he was able to revive this patient, and place the patient on the ventilator and what have you. So I got really impressed, you know, by, in that moment, I got really impressed. So that's what really inspired me. So I would say the late Mo was the one who inspired me to really go in there with this to become the respiratory therapist. So it was not what inspired me, it was an individual, single individual who inspired me, yes, to get into this field.
Wow, that's amazing.
Yeah.
Thank you very much. And the next person, whoever wants to go next.
Okay, so I want to say that there is this person called Professor Asante Poku. He was then at the Department of Biochemistry, and he called me one day and was like, Dorothy, I have come across a new program. Would you like to read more about it and get back to me? So I read back to it and went back to the professor and I said, Sir, I am interested in this. He said, You are a laboratory technologist. Why do you want to do respiratory therapy? And I said, this is a very crucial profession and a life-saving one. I'm not saying laboratory technologists that are participating here. I'm not saying the profession is. This is a very good profession, but respiratory therapy is, I mean, deals with the critical needs of the patient when it comes to the lung health and the heart health of the patient. So I read more about it, and then he directed me to the dean at that time, who became the provost. That's the Professor Ferdinand Ayukumi. So I went to him and I said, Sir, I'm interested in this program. Would you enroll me on this program? He said, No, the program is yet to start. So basically, you would be the main person who would have to advocate to get students on board. So he gave me that challenge to go look out for students in the allied health profession, that is first year students that are interested to join. So this is where I was able to get 8 people in addition to me, becoming 9. And that is how Ghana's first pioneer respiratory therapy student was admitted to the University of Ghana. So it was an individual that inspired me to join respiratory therapy. And after reading and searching on it online to see how respiratory therapists work, I was inspired to take up that profession.
Hmm. That is amazing. Thank you very much. And I'm grateful for these individuals that are actually, mentioning it and making people know about respiratory therapy profession. So even here that we are here talking now, I'm hoping and, that people, there are a lot of people here that are interested in the respiratory care profession in their different countries. So I'm hoping this is motivating you to, consider this profession and think about it. So next, maybe Maha or Haptamo. Nothing.
Okay. Thank you, Dr. Ngozi. So, as I told you, I have worked the past 13 years in emergency ICU and in operation theater. I was a head nurse in emergency department and ICU coordinator. I was very near for critical care, but my journey to respiratory therapy is really started during COVID-19 pandemic. I was one of the frontline healthcare workers, and I was a founding member of Millennium COVID Care Center. So every day I saw in ICU patients struggling to breathe. Even we have a mechanical ventilator, we don't have enough staff, trained staff to use them properly. So that experience made me realize specialized respiratory care was a missing link in our system. So that inspiring me to pursue my master's degree in respiratory care because I want to be part of the solution to help improve patient outcome and make respiratory therapy an essential part of critical care in Ethiopia. As we know, more than over 300 million people living in the world with chronic respiratory care, chronic respiratory disease, including asthma, COPD, are it is playing a huge role to manage those conditions and support with the ICU team. So for me, it is more than a career. It is about saving life, building local expertise, and strengthening healthcare system both home and worldwide. So it is a very good profession. I really inspired. So that's why I became respiratory therapist.
That's amazing. Thank you very much. Maha.
Thank you, Dr. Nagazik. For me, really, there is like Lao Tzu once said, the journey of 1,000 miles begin with a single step. For me, my first step was to become an eye doctor. I dreamed to become an eye doctor. I was inspired by my own eye doctor, and I wanted to be like him. I studied hard, but when I entered medical school, I felt at that moment it felt like my dream was over. Like someone who loves to dance but doesn't know how to dance. By chance, someone I will never forget told my brother about this new field, respiratory care. Out of curiosity, I watched just one video, and in that moment, something inside me shifted. I had found not just a profession, but a passion and a purpose, and truly my calling. Sometimes the greatest champions struggled. As Muhammad Ali once said, I hated every minute of training, but I said, don't quit, suffer now, and live the rest of your life as a champion. Yeah, thank you.
Wow, that's amazing. Thank you very much. And thank you, everyone. Thank you all very much for actually mentioning that. So the different ways and different things that motivated you into becoming a respiratory therapist. And if I may ask, what actually is what will you say now is your role as a respiratory therapist, and where you work? Can you tell us just briefly what you do, your role and how vital are you in the healthcare setting where you're working at the moment? We want to know, and people want to know as well, especially people that are really, enthusiastic and want to join the respiratory therapy profession. What can you say is just a little bit, a day in the life of a respiratory therapist at your work? And anybody can go first.
Okay, so I would want to go first. Okay, so I have experienced healthcare practice in different forms. Before I became a respiratory therapist, I was a laboratory technologist and also an educator as well. So, joining or becoming a respiratory therapist, I decided not only manage patients, also help with the training of future respiratory therapists. So in the healthcare side, I have experienced neonatal care. I've also experienced adult respiratory care as well as pediatric respiratory care. I would want to use this great opportunity to thank the Department of Surgical ICU Kolebu Teaching Hospital. I mean, especially the critical care practitioners that helped me do my first suctioning of a patient. That I will never forget.
Yeah.
At least that gave me the first boost in managing a patient. And I felt very great for the first time as a respiratory therapist. And I also want to use this opportunity to thank the neonatal ICU with the leadership of Professor Laye. She also inspired me so much as a woman to charge up to become a lead person in the ICU, especially with the neonatal care. She gave me the opportunity to be innovative, where I was able to champion the cause of making sure we save babies during the COVID pandemic. So she gave me so much autonomy to operate as a respiratory therapist. And for the first time, that was when the ICU got to know about the profession. So I want to say a big thank you to her. Um, I am also involved in training future respiratory therapists at the University of Ghana Department of Respiratory Therapy as senior research assistant and a clinical simulation instructor. I do this because students learn by visual and also by hands-on. So those are the things that inspire me to work as a respiratory therapist, and that is my everyday life. And even now, I am also involved in training students on the virtual side in respiratory care, and also in leadership. As I said earlier, I am the president for the Africa Respiratory Care Association, championing the cause of respiratory therapy across the continent of Africa and helping start this profession across various countries in Africa. Thank you.
Thank you very much. Thank you. You got me when you talked about suctioning, right? The first time. So, all right. So, the next person can go. Whoever wants to go, just kind of bring us into your daily, what you do on a daily basis as a respiratory therapist.
Um, yeah, so it was where I used to work about 2 months ago. We had this elderly male patient. I think it should be around 50, 60s.
Mhm.
Uh, this man walked from his home to the hospital in the OPD. But then I was at the health center called Hope for Women before uh, Dr. Davis took me to JFK Hospital, where I'm currently serving as the coordinator for the IMPIOS program, yeah, for the local NGO research program. So this old man was very okay. He looked very okay and went in the OPD. And then, but then doctor had not arrived to the, at the clinic yet. It was very early PM. But then, even myself, I just arrived there. So some of the nurses ran out, they ran to me that oh, Ebenezer, we have somebody who is in attack. We need your help. At least we need everybody to be here at least to help this man. I believe that man. I think that patient that was a cardiac arrest, if I'm not mistaken. Yeah. So when I got there, I saw some of the nurses had already started CPR, try to doing manual ventilation, try to do CPR. So I just suggested that we intubate this man because looking at his pulse was very his pulse was I think around 20 28 18 28 if I'm not mistaken, very dull. So he was not responsive and nothing. So uh, we went for the ET tube, and thanks for the I was able to go straight. The moment I took that ET tube, it means the ET tube and the laryngoscope. The moment I went in, thanks for the I was able to visualize the airway. At least there was no difficulty because the moment that air was going to flip back, it was going to be another issue. Yeah, so thanks for the moment I went in, I was able to see it, and that's why I didn't hesitate. I was able to intubate this man, connected to the ample bag along with the oxygen. We kept baking, After that, we noticed that he was kind of trying to breathe, trying to give spontaneous breath. So I told the team that we should give breath every on every inspiration. If we try to inspire them, we should give breath. That's when we start to do that. After that, he pause start to increase. Before then, I asked nurse to give adrenaline with some medication. They all did. After that, he pulse started to increase. We got 80 at first, but then he pulse went to 85 and what have you. Before we called the senior physician and who was there, who was still absent. She said we should transfer the patient to bigger hospital, and we were able to transfer the patient to GFK. We got to GFK and just took him straight to the ICU. 2 weeks after when I got to work, some of the nurses came to me and say, "Hey, Ebenezer, uh, if you remember the patient, you need to pay that. I say, yeah. And they say, this man wife came back to thank you, they appreciate you, but by then you are not around. As I say, well, it's not me. It's not. I'm not. I was not the only one who did it. I think it's the entire team. I think that when I thought on that, I think that gave me I think that gave me a good feeling that why I decided to get into healthcare. Yes, why I decided to become an RT. Yes, up to now, I still feel good about that.
Hmm.
Yeah.
Thank you very much. That's exciting. I mean, it wasn't then, but talking about it is good to look back and that actually really shows you the vital role that respiratory therapists play, and not just at bedside, also in education and so many areas in the healthcare setting. So that's an amazing story. Thank you. And that life was saved. Thank God. So and Maha or Haptamu.
Okay, for Baha.
Okay.
Okay. My role as RT faces a major challenges with almost no functional ventilators, incomplete ICU team. I'm not only care for a patient and support them breathe, but also I'm thinking on anything that can help save life. But sometimes also I work to raise awarenesses about respiratory care, but the reality really it is so difficult because our colleagues they not know about respiratory care, if in the healthcare. For that, yeah, yeah, my core of what I do there, it is, not just about respiratory care. I can do anything. Um, Maybe I do something. I work in emergency department. I work in operating room. I work in any facility that can help just our focus in the safe life. Like that, in our country, we are just for respiratory therapists, and for that, maybe I'm the only one in RT in the hospital. For that, I can do anything in front of me, not just in respiratory care. I do a lot of things. Yeah. For that, now I try to work together to raise awarenesses about our specialists. Thank you.
Wow, thank you very much, Maha. That's good. I mean, it's good, but then it's challenging as well, right? Because saying you're the only one the only respiratory therapist, and there's total of 4 of you. So that's why we're here. We are creating an awareness. We're advocating for more to support that effort and to support respiratory and lung health in Chad. Haptamo, do you want to maybe bring in, your life, your time, your day as a respiratory therapist, and maybe you can go straight into the challenges that you're seeing and you're facing.
Okay, let me speak with my role. So, as a respiratory therapist, helping patients with breathing problems is my main role. So, especially we are assigned in ICU. As I mentioned before, I work in St. Paul Medical College, but recently in Seychelles. But St. Paul is a big hospital. It is more than 800 bed capacity, and there is a big ICU. So our daily activity was detailed patient assessment, managing ventilators, and provide expert airway management. And also, we were trying to engage private sectors to start new facilities like sleep lab. So we were trying to open 2 sleep labs in private hospitals with collaboration with my friends. So still they are running. The respiratory therapists are running that sleep labs. other responsibility, my role, we established Ethiopian Association for Respiratory Care. So my role as a board member and secretary general. I will do some advocacy activities. So in short, my job to make sure patient is safe and they get right respiratory support all the time. That's my role. So I will mention it all struggles later.
Okay. And just before we continue, if you have, I don't know, family, you're raising your hand, but if you have any questions, actually, we'll wait to the end of the session, or you can post it now on the chat so we can address that. So you can actually have Tamu, you can go straight to the challenges. That's the next thing I wanted to find out. What are some of the challenges that you're facing to really progress in this profession in your country? What the challenges? What can you bring us into that?
Frankly speaking, we face a lot of several challenges. So the first thing is recognition. So respiratory therapy is still a new profession in Ethiopia, and many healthcare professionals, policymakers don't fully understand our roles and values. So that's a big challenge. So we try to advocate, we try to promote the profession. Second challenge, we are few in the country. So over 130 million population, around like 30 up to 35 respiratory therapists are working. So it's a big challenge to give quality of care for whole patients. So shortage in number. And the last, we are limited in resource. So many hospitals, especially outside major cities, lack modern equipment, supplies, which makes hard to provide consistent and high quality of care. So from those, a lot of challenges, these are the biggest one to mention over here.
Yes. So what I've heard, and I believe Maha, you mentioned it before too. You mentioned some of those challenges in when you spoke previously about the lack of recognition and the resources, and of course personnel, right? If you're the only one in the hospital and then there's 4 in total, then definitely there's lack of personnel. So apart from the resources or equipment and the personnel, is there any other challenge that is different from these two? Maybe Ms. Dorothy or Ebenezer, any other challenges that you're facing, that you're seeing in Ghana and Liberia?
Okay, thank you very much. So in Ghana, what I would also want to say is not far from what Haptamu said. We have limited resources also, especially because in Ghana, it's University of Ghana that is training respiratory therapists, and a lot of resources is required to train respiratory therapists. We will need students lab to be, a well-furbished student lab is something that has been a challenge that we need. I also want to talk about the burden of respiratory diseases in Africa, or that is in Ghana specifically, and then having few respiratory therapists in various ICUs or maybe hospitals across the capital city of Ghana, and then Ghana having a population of about 35 million and with few respiratory therapists just in Accra and in Ashanti region. So that poses a lot of stress on our medical team. And this makes, for example, our doctors, our pulmonologists, our critical care specialists overwhelmed in managing these cases. So that has been some of these the challenges. And lastly, I also want to talk about awareness and recognition. Yes, indeed, the Allied Health Professions Council and the Ministry of Health are doing their best, but there is more to do when it comes to awareness and recognition of our profession in Ghana.
Yes. Ebenezer, do you want to add to that and speak for Liberia, please?
Yeah, I don't think there's anything that need to be added. I think what my brother and the president they both just said are the same major problems that we are having here: limited resources, and also also especially the burden of respiratory diseases, and we don't have much ROTs in the country. 99% of the ROTs are, they are already functioning within Monrovia. So I think when it's really kind of a sad. Sometimes you hear news in the rural areas, yeah, where in you will see you will hear that all this person died of maybe hypothermia, somebody died of because there was no oxygen, somebody that is very very kind of sad. So we have lot of challenges on ground. As yeah, a lot of
Yeah.
challenges. Is I mean,
Absolutely. Yes. I think every country actually in Africa will share the same challenges, And the thing is, like you mentioned, Ms. Dorothy and Ebenezer as well, you mentioned the prevalence of respiratory diseases and illnesses, especially in low and middle income countries, which most of the African countries really fall under, and then lack of personnel and respiratory profession to help and to treat these diseases.
yeah,
So this is like a cry for urgent cry for help, to us, all of us, and then to the public, the leaders, that our countries, we need help. Africa needs help when it comes to respiratory diseases. And we are all here because we're willing to help and be part of that change. So we're going to move on to the next question here. So is there any of you actually, do you think, is there a way that you're navigating, maybe you and your team, how are you able to navigate through these challenges? How are you, able to do your duties as a respiratory therapist? I know it's a big challenge, but how are you actually navigating through it?
Okay, so I would start with Ghana
Mhm.
because, yes. And with this, I would want to acknowledge the presence of the Vice President of the Ghana Association for Respiratory Care, Madam Josephine Osaitu Kurang Dugenon. And I would want to say that what I have been able to do as an individual for my country is that with the collaboration of the Ghana Association for Respiratory Care and the Allied Health Professions Council, we have been able to push our voices to the Ministry of Health, to recognize. So first of all, they are making efforts to recognizing and putting us on the salary scale or salary structure. Thereby, we are also going through that process of being officially recognized in other regions of the country. Thereby, when it comes to employment, our professionals can also be employed. So those are some things that the local association, which is the Ghana Association for Respiratory Care, and the Allied Health Professions Council, that's our regulatory body, joining us to push our voices across to the Ministry of Health.
Well, thank you. That's amazing. So, and anybody else want to just kind of share what it is that how are you able to navigate through this challenge? Is there anything you're doing or trying to reach out to the ministry or government?
Okay.
yes,
Okay,
yes.
Ebenezer,
All
go
right,
ahead.
I should go. I should go ahead. All
Yes.
right. Yeah. So what I've managed or we have managed. First, thanks to Dr. Davis and Mr. Darwin, whom they both of them who have worked closely with the GFK Medical Center. They have established permanent units, which is the bubble CPAP for babies because the mortality rate for children under five newborns, in one of you is really kind of it was really kind of high. So Dr. David was able to work along with his team in the States. So this program has already been established, and we are looking forward to training more ROTs when it comes to that's permanent bubble CPAP. And also we have made our case to the then minister, because right now we have a new minister. So that's the new, to be more specific, new minister of health. We made a proposal, but about RTs, the need for more RTs to go in the rural areas. And I can tell you for sure that there are RTs currently who are willing to go in the rural areas, but who will be responsible for them? Yes. Who is going to take up that responsibility financially to do that? So at least the Ministry of Health have incorporated respiratory therapy into the health cadre, that is salary, skills, and what have you, and respiratory therapists has been included, has in the allied health professional has a specialist fee, and at least their starting salary is really really encouraging. Yeah, that's why we have put into that. But I can see there are a lot of more we need to put into it, into put our things into that.
Yeah.
Yeah.
Absolutely. Thank you very much. Haptamo, go ahead.
Okay. Currently, we are focusing on advocacy because we all starts from promoting the profession.
Yeah.
So we established Ethiopian Association for Respiratory Care last year, and we work together with local and international partners, including ARCA. We organized workshop awareness events, such as during World Respiratory Week. For your information, we have some workshops next week in St. Paul Medical College. Guests from Ministry of Health, from local NGOs, international NGOs will attend. That give us to promote the profession. And also the best strategy we show results through evidence. So we collect data showing how RT cares improve outcomes. For example, fewer ventilator days, fewer complication, faster recovery. Then we present those information to hospital management and Ministry of Health. So that really give concrete information for them. So that's our strategy. Also, we also focus on collaboration with others, medical professionals like doctors, nurses. We show RT doesn't replace anyone. We strengthen the whole healthcare team. So collaboration is a must. So we try to work together, and now it's an improving. Ministry of Health, including respiratory therapy in ICU organogram. That's a great achievement. So we tried our best to advocate the profession.
Wow. Thank you. That's amazing. And you already actually went into what you're doing for the respiratory care month. You talked about workshops and stuff. So that's a great way to also, continue to create that awareness. And this is what respiratory therapists are doing and what we do. And this is more to it than this, just treatments so there's more. And so Maha, real quick, if you can also tell us, I know how you kind of have talked about it already, how you're navigating through these challenges. I believe, I guess wherever they call you when it comes to airway or, respiratory problems, you're always available there. That is amazing. And, amazing job that you're doing, being the only one. So, but kind of bring us in what are you doing? Is there something that you're doing in Chad over there to create that awareness, especially in this respiratory care month, in this month of October? Is there something that you or your team are doing, like workshop, like Haptamu mentioned?
Yeah, in Chad, really, respiratory care month is still free new, but we are working to make it feasible through use social media to spread awarenesses, share messages, and tell stories about respiratory care. And otherwise, the activities is still modest.
Yeah.
Yeah, but every year they grow, and we all try to do something, but really it is take it is the step in this take time, and not response quickly like that, but we are trying to
Yeah.
do. Yeah.
Absolutely. Every great thing starts with the first step, and you've already taken that first step, and all of us here. So amazing and great job to everybody. Actually, I just want to say before I continue, it's not easy, but we are pushing and we'll keep going. We can't stop because there are lives connected to the mission of ACA. Ebenezer, real quick, is there anything that you're doing there in Liberia for Respiratory Care Month? Um,
Yeah, sure. Right now, there's a ongoing payment for t-shirts, flyers, because we are preparing to go on community outreach, schools, both high schools and colleges, universities, and what have you. And we will also be doing free vitals for people, as well as reaching out to people who are susceptible and who are more vulnerable. Maybe those bag riders, those or keke riders, and what have you. Those that live in the slum and what have you. So that's why we are planning
mm,
to do. Yes,
mm,
but the payment is only for t-shirts and flyers, because people need to be educated
mhm.
about respiratory diseases, and respiratory disease is really on a rise in Africa. Is
Mhm.
very really on the rise, and yes,
Mm,
is one of the major causes of death in Liberia. Yes,
yeah,
mortality. Yeah, that's
yeah.
why. Yeah,
Thank you
people.
very much. And thank you also for, and you mentioned schools, going to schools and, to create that awareness. That is all a great place to go. And you also mentioned remote, there are those remote places that people with, again, the help or resources are not even getting in there. And you mentioned that. I think that's one of the things that you're doing, to go in there where people don't even know that, there are lives that exist there. And, so thank you very much for saying that and for what you're doing there in Liberia. Ms. Dorothy, do you want to add to what Ghana is doing at the moment for Respiratory Care Month?
Okay, so Ghana has a list of engagement or activities that they are planning. Just like Ebenezer said, they are also working on getting their t-shirts for more advocacy.
Mm-hmm.
And then the Ghana Association for Respiratory Care is also engaging with social media. So they're going to use social media a lot in advocacy. They're also going to use the radio and TV stations. So they're working hard on that side also. And then on my side, as the governor for Ghana at the International Council also, I am taking my position as engaging all stakeholders in Ghana, especially the Ministry of Health, the Allied Health Professions Council, and also engaging faculties, engaging key stakeholders in the country to recognize and also push our voices across. So that is what I am doing. And also at the international front, I also want to say a big thank you to the International Council for Respiratory Care. We are projecting Ghana a lot at the International Council for our needs and to be heard at the International Council. And on the Africa front, what I'm doing as the president of the Africa Respiratory Care Association is indeed, yes, the webinars that we are having now. This month, we are going to have series of webinars. We are actually bringing diversity, inclusiveness, and equity across the continent of Africa by instituting the language webinars, whereby we have webinars in Arabic, we have webinars in French, webinars in Portuguese, as well as the English webinars that we are participating now. So, this is going to involve everyone in Africa, because Africa is not just an English speaking continent. We have all these very great languages. So we are doing our best to reaching out to everyone to be educated and get the awareness of respiratory therapists and the respiratory care or the diseases that exist when it comes to managing patients. So that is what we are doing on our side here. Thank you very much.
Thank you. Thank you all so much. Another question I'll have for you is, how has ACAR, so being part of the Africa Respiratory Care Association, how has this organization helped you in your country to really showcase the respiratory care program and profession? So can you, anyone that wants to go first, just kind of let us know how ACAR has helped you in your journey as a respiratory therapist?
Okay, let me start.
Mm-hmm.
So ARCA has been a great partner through training, networking, and advocacy. So ARCA connects us with other African artists. We can share experience, learn from each other. So they help us to access training opportunities and educational materials. That's really useful for us. And also ARCA give us a strong African voice. With their support,
Yes.
we can speak together with ministries and gain a formal recognition for the RT profession. So across the continent, we need a strong organization like ARCA. So I would say like keep going. We should have to strong more. And thank you for everything that we ARCA give us for Ethiopia.
Amazing. That's amazing. Thank you. Maha, do you want to go next, please? How has ACAR helped you?
Yeah.
Mm-hmm.
Really, ARCA has a real resource of strength for me and for Chad. They have connected me with a wider network of RTs across Africa, which showed me that we are not alone in this journey. They provide a mentorship, technical advice. Also, ARCA given us a platform for advocacy, and that support make a huge difference as a turn an individual efforts into a collective movement for a challenge. Yeah, thank you for this chance, really.
Yeah. Wow. Thank you very much, Maha. I appreciate that. Mr. Ebenezer, please.
Yeah, thank you very much. Big thank to ACA because with the numbers of calibers of great facilitators, ACA has been bringing to light here to educate us. For me, I would say it has really been a privilege because I've been just been I've not just learned, but ACA has impacted me, a lot, not just me, but my entire team, my association. Yeah, so ACA has been very, very much instrumental in that. Yeah, I very, very appreciate that from ACA.
Well, thank you
Thanks so
very
much.
much. Yeah, we appreciate that. Ms. Dorothy, how can you answer that question? You're the president of the Africa Respiratory Care Association. You started this for everybody. We are appreciative of you, actually.
Thank you very
But if you
much.
can, how has how has ACA helped Ghana, the country of Ghana?
Thank you very much. And okay, so first of all, Ghana, let me take Ghana and the association over there. Um, I was a former president of the Ghana Association for Respiratory Care. I saw what respiratory therapists went through in Ghana. I saw the challenges. I saw what went through every stage of becoming a respiratory therapist. I saw the efforts that our faculties put in to train us. I mean, they bent their neck to put all this together for us to become respiratory therapists. So, if I'm here today and I'm the president of the Africa Respiratory Care Association, all my faculties that are watching me now, I want to say a big thank you to you for training this individual to be this leader of this continent and also be a national leader. Thank you so much. I really appreciate that. ACA has impacted the the Ghana Association for Respiratory Care, because it has now become the voice in championing respiratory care for Ghana, and also reaching the ears of the Ministry of Health and all stakeholders that would help foster or champion the recognition of the profession. So ACA is not standing alone. ACA is working hand in hand with the Ghana Association for Respiratory Care. And this, I would also want to commend the executives of the Ghana Association for Respiratory Care for supporting me and encouraging me to even push to this level. They are the ones that actually do the legwork in getting to these stakeholders and pushing our message and our voices across. So Ghana Association for Respiratory Care is really doing a lot and impacting the whole nation of Ghana. And at the International Council, the Africa Respiratory Care Association is also projecting Ghana on the world map for our profession to be heard and for all these challenges that we have brought across to be heard. Now, also at the Africa Respiratory Care Association and with the International Council, I only not showcase Ghana, but I showcase the entire continent to the International Council, because what pertains to Ghana also pertains to Ethiopia, also pertains to Liberia, and as well as Chad. So whatever problem there is, Africa is what we present across. But locally, our stakeholders are doing their best. I mean, through the local association, which is the Ghana Association for Respiratory Care. Thank you very much.
Thank you. Thank you so much. Now, the final question I have for you all today is, what is your vision for the future of respiratory therapy profession in Africa? So what do you envision? And if you have a message right now for aspiring respiratory therapists, or message for, leaders, politicians, policymakers, what would that be? And who wants to go first? Your vision for respiratory care in Africa and your message to aspiring respiratory therapists and our leaders in Africa.
All right.
Yeah.
Yeah. So our vision, my vision for respiratory practice in Africa, first is to see the some an RT from Ghana who will come to Liberia, and he or she doesn't have to go back to school to do respiratory science. Is to see all African countries have the same teaching curriculum. Yeah, and also is to see that RTs are at their best, and respiratory therapy and respiratory care is well recognized. And for Liberia, my vision is to see that all respiratory therapists are in all 15 counties. Yes, yeah, because imagine people who are here in the city, find they're having issues they're having respiratory issues. Talk more of those who are in the rural places. I think they are more vulnerable. Yes, I think that is one of those things that is really, really on my heart. Yeah, to really see that. And lastly, um, in a word of encouragement for somebody who is aspiring to be an RT, I want to say, if this is what you want, yeah, don't be afraid. You should go for it, as long as this profession is in your respective country. I want to say, trust me, you will not regret doing this. RT is a very beautiful profession. It is very, very great. You are not limited to only a particular department. You work almost every area of the hospital. Yes, and you study almost everywhere. And one thing you should keep in mind, that um, every every process of the human body, every process or procedure of the human body requires oxygen. all processes and functions of the human body requires oxygen. Now, to come to think of it, who are responsible in that area? Yeah, so it's very, very much important. So I want to say, whatever path you want to choose, make sure you mean it and follow it with intense passion. Yeah, so that's the message. Thank you very
Thank
much.
you very much. That's amazing.
Yeah.
Thank you for also bringing up the oxygen. I mean, we cannot survive without oxygen, right? And who best to do that and advocate for better oxygen therapy than, respiratory therapists? Who else wants to go, please? Haptamo, you can go.
Okay. Okay. So before I proceed, can you give me 1 minute to recognize some individuals? So let me mention first Hanan Ali. She is our association president and vice country director for ARCA. She is doing really good in formation of our local association. So I would like to say thank you for your dedication. And also Gashao, he is vice clinical director in St. Paul Medical College. He is doing good. He's organizing workshop and trying to advocate respiratory care. Yadasa is working in military hospital. He's doing good in on his side. So all Ethiopian Respiratory Association board members, I thank you. So my vision, finally, my vision is clear. I want to respiratory therapist in every hospital in Africa. Everyone, no matter where they live, should have access to proper lung care. So this is my vision. To aspiring authorities, this is a demanding but very rewarding career. You are lifesaver and a key member of healthcare team. Keep learning, stay passionate, and take a pride of your role. Or it is an international profession, so you can work wherever you go. So this is what I have for aspiring artists. For healthcare leaders, COVID-19 pandemic taught us that lung health is a public health. So investing in training and employment of respiratory therapists is not a luxury. It is a must to building a strong, resilient healthcare system that saves lives. So we should have to focus on lung health because 300 millions of people in the world has respiratory problem. We need more artists. Thank you. Finally, Africa doesn't just need more ventilator. It needs more respiratory therapists. Let's build that's the future together. Thank you, Dr. Ngozi.
Thank you very much. Thank you. Maha.
Yeah. Thank you. My vision is for respiratory therapy recognized across Africa as an essential part of healthcare. Also, I hope to see every country develop its own training program. My message for RTs, your work matters. Even the smallest intervention helping one patient breathe more easily can change a life. And my message for health care leaders, I say investing in respiratory care is investing in survival. Together we can build a future where no patient is left struggling for a breath. Thank you so much.
Thank you, Maha. Ms. Dorothy.
Thank you very much. So on this note, I want to say that my vision is in two folds for Ghana and also for Africa. So for Ghana, it is my vision that the profession would expand into all regions of Ghana, and then for us to get more respiratory therapists across the regions of Ghana. I also have a vision that we have most of our government universities establish respiratory therapy program in those universities across the country. And lastly, it is my vision that employment of these respiratory therapists becomes a reality since we are growing in numbers. Now, my vision for Africa is that we have respiratory therapists across all 54 countries in Africa, and oxygen become very affordable and accessible to all individuals, and also for Africans to have adequate and quality respiratory care. My message for future artists or anyone that is pursuing the respiratory care program is that learn hard, because you have come in at a time like this to also be part of the history making in Africa. The breath of Africa, the lungs of Africa depends on you. And for all leaders and stakeholders, especially for all those that are participating and all those that are going to watch us after this webinar, I would want to say that investing in this profession, it's not a loss. Investing in this profession is breathing life into Africa. Therefore, I call on you to help push our voices across to the main ears that must help us. Thank you very much.
Thank you. Thank you, everybody. That's actually all the questions that we have. And this was an amazing session. And we've heard it all. We've heard, from what actually motivated them to become respiratory therapists and a day in the life of a respiratory therapist in their country. And we've heard the challenges that they are going through. The challenges cut across every country, actually in Africa, right? It's from poor resources, personnel, I mean, you name it. It's so many things. And yet, Africa has the most prevalence in respiratory problems. So this has to change, and ACA has come to change this, promote better respiratory health. And we've also, I think what I'm hearing is, a lot of everybody kind of mentioned the same standard, to have the same standard in all African countries, right? We have 54 countries. So it would be nice to have respiratory profession in all 54 countries, and not just in one or two hospitals in the country, but rather, like Mr. Beneza said, in every facility, every healthcare setting, and especially the remote places. Those are the places that people don't even think about, that people exist over there. So I'm saying it, I guess, because it's a passion. It might be personal, right? Because I grew up in Nigeria, so I know the challenges that people are going through. Lives are being lost, just like that. So we have to continue to create that awareness, continue to advocate, and hope that it gets to the ears of people that need to hear it, our leaders, our policymakers, the changers, the people that can make that change and initiate it. So that is why we keep doing the webinars and creating that awareness. Respiratory health must be improved in the African continent. Okay, so I want to let me see, there's a question in the Q&A, and they might have, maybe we've addressed it already. Somebody said, are there any continental or regional initiatives to standardize respiratory therapy education across Africa? Ms. Dorothy, do you want to answer that? I think maybe we've touched on that, but please, can you touch on that?
Okay, so briefly, I would want to say the webinar series is one of the initiatives that we are doing to encourage that. And this brings across all respiratory therapists who have the experience over the years across the globe to educate and present on various topics and various issues in respiratory care in our webinar series. So our webinar series is one of the initiatives. And also we are engaging various schools in promoting or training people or creating awareness. For example, asthma education in local schools, where we are training we are training teachers on the recognition of asthma symptoms and how to manage these cases before it gets to the nearby facilities or clinics. So we are doing a lot of community outreaches, a lot of education, and this webinar also stands out to give us more know-how and awareness.
Thank you. And the same person, Berhanu, he said, how can countries without formal respiratory therapy programs begin building this profession? Go ahead, Mr. Rati. Sorry.
The,
I'm
the,
posing all the questions to you. How can countries without formal respiratory therapy programs begin building this profession?
Okay, thank you very much. So what you will have to do is to start engaging from the government level. It has to do from the level because you have your Ministry of Health, you have Ministry of Education, and these are the key people or the key stakeholders that we need to start off with, to identify the programs or identify the profession, first of all, because if they don't understand who respiratory therapists or what we do, they may not be able to appreciate what you are presenting to them, even though it's a life-saving profession. So it is about engaging key government stakeholders first.
Mm. Thank you. Sorry, to the next, okay, he also asks how is ACA promoting innovation and technology integration in respiratory therapy, like
Okay, so
telemedicine? Mm-hmm.
Okay, so thank you very much. So what ACA is doing is that we are engaging with respiratory care industries across the globe, and one of it is our lead sponsor, which is Zopec Medical, bringing up an innovative solution in patient management and patient health care. So those are one of it. We have also engaged with other respiratory technological companies or industries that can also support initiatives in Africa.
Mm. Thank you. Now two more questions, or maybe how can we get the 20 points CPD for those in Ghana?
Okay, so this question is from Ghana. So
Mm-hmm.
what you have to do is to check in the chat box. It has a link that you have to click on, which is webinar at africaresp.org. When you click on it, there is a form to fill. You provide your details, and then the team would help you get your certificate, of which you can use to get your points for your licensure.
All right. And Rita said, how do I become a respiratory therapist and how do I get my certificate?
You have to go to a respiratory therapy school. So, for example, if you're in Ghana, we have the program at the University of Ghana. Maybe you are in other African countries, but you should have first of all have pursued a science at the senior high level. So you should have a background of biology, physics, chemistry, and elective maths. At least you should have those basic sciences in your transcript to apply to an institution that offers respiratory therapy. And obviously, yes, we have it in Ethiopia. We also have it in Ghana. Yeah, so you can apply with that. And when it is reviewed and your transcript meets up the requirement, then you would be admitted.
Mm. Thank you. And the last question I see, or maybe not the last. Okay, yeah, the last for now is Dr. Isaac here. What is the engagement and support from your national government to respiratory therapy in your country? I'm not sure which specific country it's referring to, but what is the engagement and support from your national government to the respiratory therapy? Did you?
Maybe have time, we should take it.
From our side, we have continuous communication with higher officials. So Ministry of Health really support us to develop or to like increase the respiratory care. So we try to open BCC level respiratory care in other universities. So that will be great to increase number of respiratory therapists. So we are working together with the Ministry of Health.
Thank you very much.
Okay, so in Ghana, our regulatory body is the Allied Health Professions Council. So the Ministry of Health works through the Allied Health Professions Council to regulate the profession in Ghana. So when it comes to government bodies helping the profession, these are the two government bodies that are helping. And Allied Health Professions Council of Ghana is the regulatory body that regulates our licensure and everything.
Okay, thank you very much. And for the last question that's asking about the CPD points, I think if you go to the chat, you'll see the information on that. on how to get your CPD. Okay. And that's all the questions that are out there. And I just want to say thank you, a big thank you to everyone that joined in today, and especially to our, pioneers of respiratory therapy in their, different countries. Thank you so much, Aptamu, Maha, Ms. Dorothy. Thank you. Thank you, Ebenezer. Thank you, everybody. I appreciate that. So I just want to say one thing, ACA is pushing not just for we want a standard, standard for respiratory care in all countries. We want it to be the same. We want a situation where someone can actually go from one country to the other and still practice as a respiratory therapist. And that standard is a bachelor's degree, nothing less than that. It's a bachelor's degree and master's level, just like the physicians go to that intensive school, medical school. Respiratory therapy is also there. We do that intensive training for 4 years, 5 years, and so that you come out knowledgeable and really confident to defend that profession. So again, thank you so much for this time. Ms. Dorothy, do you want to have a last say before we go, please?
Okay, so I would like to say that we cannot do all these things that we are doing without support and donations coming in. And this, I would say that the Africa Respiratory Care Association is calling on everyone, including you that is watching us today, to support and donate. Now, if you want to support the Africa Respiratory Care Association in any way financially, you can support us. Or if you are an individual or maybe a company that wants to support our initiative, we would actually appreciate it a lot. And maybe you want to donate to the Africa Respiratory Care Association. You can also donate at africaresp.org.